get to your guidance for young people specifically, who are a very important part of how we slow the spread of this. And I know a lot of younger people are watching this right now, and I know this because the last time we did a live video, I think all the streams were viewed, I think more than 50 million times, including by a lot of young people. And young people are going to be really critical to getting this right, because right now a lot of the new cases are younger folks. So what should young people be doing to stay healthy and to make sure that they can keep the people around them healthy?
Mark, thank you very much for asking that question, because I think it's critical to everything that's going on right now in the country. If you look at what's going on with the new infections, the age range of the infection, the median age, is about a decade and a half younger today than it was a few months ago. So you're absolutely right. Young people are intimately and heavily involved in what's going on now with this pandemic. So let me just say one thing, and I address it to the young people who are watching this. It's totally understandable that you see the data. Young people are smart. They know what data means. And the data tells us that if you're a young person, the likelihood when you get infected of getting seriously ill is much less than an older person, the elderly, or people with underlying conditions. That's just the truth. That doesn't mean that some young people, and we have ample examples of that, who are young and otherwise healthy, can get seriously ill. I mean, really seriously ill, or can be knocked out on their back and brought to their knees pretty quickly. But let's take the majority of young people who get infected and don't even know they're infected. You can get the mindset, well, listen, if I'm infected, I don't know I'm infected, I'm not feeling sick, who cares? I'm not bothering anybody else. That is incorrect, because by allowing yourself to get infected, you are propagating the pandemic. And let me explain what I mean by propagating it. You can't think of yourself in a vacuum, because if you get infected and you don't know it, then you're going to might innocently, and I'll use the word innocently because I don't think there's any malice here. You can innocently infect someone else, who then might infect someone else. And then all of a sudden, a vulnerable person, an elderly person, a person who's immunosuppressed, a child with cancer on chemotherapy, when they get infected, then you have a serious problem. So what I would urge and almost plead with the younger people, because I know if they really understood this, they would take it seriously, that you have to have responsibility for yourself, but also a societal responsibility, that you're getting infected is not just you in a vacuum. You're propagating a pandemic.
I want to talk about the racial disparities here, which I think are really troubling. The CDC has reported that Black, Latinx, and Native Americans are 4 times as likely to be infected with COVID and twice as likely to die as white Americans. So what can you tell us about what we're seeing here and what is being done by the government to address this?
Yeah, that's a very good question, Mark, and a very disturbing phenomenon that is a reality. And there's an explanation for it, and there are things that we can do about it immediately, but things that are going to take decades for us to correct. So if you look at the fact that if you look at minorities, as you mentioned, African Americans, Latinx, Native Americans, and Alaskan Americans, if you look at that group, although you don't like to generalize, but it is a fact that as a demographic group, the kinds of jobs that they generally have do not allow them as much to do the kind of telecommunication that we're doing right now, that put them in so-called essential jobs where they're outside in a situation exposed enough to have a greater incidence of infection than someone who could call a timeout and do work from the quiet and solitude of their own home. So they have a greater chance of getting infected. Once they do get infected, as a group, if you look at the underlying conditions that lead to a higher likelihood of a bad outcome, those demographic minority groups have a much higher incidence of that. And I'm talking about hypertension, obesity, cardiovascular disease, other types of chronic lung disease, diabetes. Those are the things that put you at a higher risk. So the immediate things that we can do now is that, how do you address that? What you do is you put resources where you have a demographic concentration of individuals so they can get tested easily, contact traced easily, have access to care, get under the care of a healthcare provider quickly to try and mitigate the advancement of disease. You can do that right away. We can concentrate resources in those places, making sure they get things that they need right away. The broader picture of the social determinants of health that lead to minority groups having a higher incidence of diabetes, of obesity, of lung disease, of heart disease. Those are the kind of things that we as a society need to address and commit to doing over a period of decades, because that's not going to change overnight. But let's at least do the things that we can fix now.